Tadalafil is everywhere. You've seen the ads, you've heard the promises, and maybe you've even considered taking it daily. But what if the very pill that's supposed to improve your life is quietly causing damage? Side effects that don't hit all at once, but creep in slowly, subtly, over weeks or months of use. Here's the truth. Most people only hear about the success stories. But in this video, we're going to explore 6 side effects of Tadalafil that are medically documented, often underreported, and sometimes even ignored by doctors. Some are mild, some are strange. And one of them? It may affect your ability to hear permanently, and it's more common than you think. But that's not all. There's a 7th side effect, rarely talked about, that doesn't show up in the blood, but in your mind. We'll reveal that hidden consequence in Chapter 7. And if you're a regular user, it might explain a few things you've been feeling lately. Before we dive into side effects, let's first understand what Tadalafil is and why so many people are taking it daily. Most people think of it as a performance drug, but that's only part of the story. What Tadalafil really is. Tadalafil is a PDE5 inhibitor, a medication that relaxes the smooth muscles in blood vessels, allowing for increased blood flow. While it's most famously used for erectile dysfunction, ED, it's also prescribed for benign prostatic hyperplasia, BPH, enlarged prostate pulmonary hypertension under different brand names, and off-label uses like vascular support and performance enhancement. Unlike Viagra, which works for a few hours, Tadalafil's effects last up to 36 hours, and it can be taken in daily low doses, 2.5 mg, 5 mg. Why people use it daily? Daily Tadalafil offers spontaneity, no need to time the dose before activity, steady blood flow support, especially for men over 40, improvements in urination for BPH sufferers, anecdotal reports of better energy, recovery, and sleep. It sounds great, but here's the problem. Daily use means daily exposure, and that increases the likelihood of cumulative side effects. Some are obvious, some are silent. And in Chapter 2, we'll begin with the most common and underestimated one: headaches and vascular pressure. Tadalafil is designed to open blood vessels, but that's a two-edged sword. What feels like improved circulation in some parts of the body can feel like pounding pressure in others, especially the head. Why it happens? When Tadalafil inhibits the PDE5 enzyme, it allows nitric oxide to expand blood vessels throughout the body. This includes the arteries in the brain. The result? Blood vessels dilate, pressure inside the skull increases, and the classic Tadalafil headache begins. These headaches can range from a dull, tight sensation behind the eyes, pulsing pain in the temples, sensitivity to light or sound. And here's the kicker: they're often resistant to over-the-counter pain meds. Risk factors. You're more likely to experience this side effect if you're dehydrated, you take other vasodilators, like alcohol, L-arginine, or blood pressure meds, you already have migraines or tension headaches, and when taken daily, even mild vascular tension can become a persistent background stressor on your nervous system. Pattern break. A story. One man began using 5 mg Tadalafil daily to help with BPH. After 2 weeks, he noticed he was waking up with mild headaches, and by mid-afternoon he couldn't focus. It wasn't until he paused the medication for a week that he realized the headaches stopped. What you can do: stay hydrated. Always take Tadalafil at night to sleep through peak dilation. Avoid mixing with alcohol or pre-workout supplements. If headaches persist, consider reducing your dose to 2.5 mg or taking every other day under medical guidance. Up next is a side effect you probably wouldn't connect to a pill for blood flow: nasal congestion, sinus pressure, and a surprising impact on breathing. Imagine taking a pill to improve circulation and ending up feeling like you have a cold every single day. That's exactly what some daily Tadalafil users report. And it all comes down to how the drug affects tiny blood vessels in your nose and sinuses. The science behind it. Tadalafil causes vasodilation, the widening of blood vessels, but it doesn't only happen in the genitals or heart. It happens everywhere, including the nasal cavity, the sinuses, the membranes that line your airways. This leads to stuffy or blocked nose, a feeling of pressure in the cheeks or behind the eyes, post-nasal drip or mild sore throat, reduced airflow, especially during exercise or sleep. It's not an allergy. It's vascular congestion, and it can feel like you have a mild sinus infection every morning. Real impact on daily life. For some people, this side effect becomes a source of constant irritation, a barrier to quality sleep, especially if breathing is impaired, a reason to stop taking the drug altogether. And here's the kicker. Antihistamines don't help because it's not an allergic reaction. Worsening with time over weeks or months, this kind of low-grade sinus congestion can disrupt your sense of smell, impact your taste, cause chronic mouth breathing, lead to snoring or sleep disturbances, especially dangerous if you have sleep apnea. What you can do: take the pill at night to sleep through peak congestion. Use nasal saline spray or a neti pot to flush out your sinuses. Try menthol steam inhalation before bed. Consider adjusting dosage or frequency if congestion becomes chronic. Now, we move into more serious territory, a side effect that could impact how you see the world. Literally, most people take Tadalafil thinking the risks are only physical, like headaches or congestion. But what if the pill could change how you see the world? Literally? Let's talk about the visual side effects that come with this medication, and why some of them can't be reversed. What's going on? Tadalafil doesn't just affect PDE5, the enzyme related to blood flow. It can also interact in high doses or in sensitive individuals with PDE6, an enzyme found in the retina of your eye. When that happens, users may experience blurry vision, light sensitivity, difficulty distinguishing between blue and green hues, a sensation of seeing halos or brightness around lights at night. The rare but real risk, NION, one of the most alarming but rare conditions associated with Tadalafil, is non-arteritic anterior ischemic optic neuropathy, NAIN, a condition where blood flow to the optic nerve is disrupted, leading to sudden loss of vision in one eye. No pain, just a sudden, blind spot, often permanent. Although rare, NAIN has been reported in men taking PDE5 inhibitors like Tadalafil, particularly those who have diabetes or high blood pressure, smoke, already have optic nerve crowding or vascular disease. Pattern break, a real case. A 52-year-old man took daily 5 mg Tadalafil for 2 months. He began noticing color distortion and gray fog in one eye. He was later diagnosed with early-stage NION and had to stop the drug immediately. His vision improved slightly, but never returned to normal. What you can do: if you notice any changes in vision, stop Tadalafil and see an ophthalmologist immediately. Avoid use if you have a history of eye disorders or vascular problems. Don't take it alongside other vision-impacting drugs without medical advice. Consider getting a baseline eye exam before starting long-term use. Up next, a side effect that's less visible but just as frightening: sudden hearing loss, ringing in the ears, and inner ear damage. What does a pill for blood flow have to do with your ears? More than most people realize. Tadalafil, like other PDE5 inhibitors, has been linked to sudden hearing changes, including partial or complete hearing loss in one ear. And the scariest part? It often happens without warning, and sometimes it doesn't come back. What the research says: Tadalafil may reduce blood flow to the cochlea, the part of your inner ear responsible for translating sound into nerve signals. Some reports suggest it may also increase pressure in the inner ear, interfering with auditory function. Known symptoms include sudden hearing loss, often in one ear, tinnitus, constant or pulsing ringing, muffled or distorted sounds, feeling of fullness or pressure in the ear. The numbers according to an FDA analysis of PDE5 inhibitors. Dozens of cases of sudden sensorineural hearing loss have been reported. Many occurred within 24 to 48 hours of taking the drug. Recovery is possible, but not guaranteed. Some users required steroids or hearing therapy, and some lost hearing permanently. Pattern break, true story. A healthy 40-year-old man took low-dose Tadalafil for gym performance and mood. After a few weeks, he developed high-pitched ringing in his right ear. He ignored it, thinking it would pass. Within days, he noticed he could no longer hear in that ear. Specialists ruled out infection and traced it to vascular disruption from PDE5 use. He regained partial hearing, but the tinnitus never left. What you can do: stop immediately and see an ENT, ear specialist, if you notice any hearing changes. Avoid Tadalafil if you already suffer from tinnitus or hearing loss. Monitor closely for ear pressure or distortion. Consider using the drug only under medical supervision, especially long-term. You might not expect a medication that improves blood flow to cause muscle discomfort, but that's exactly what happens for some Tadalafil users. And if you're waking up with stiff legs, sore lower back, or aching thighs after starting the drug, you're not alone. Why it happens? Tadalafil causes systemic vasodilation. That means muscles, too, receive increased blood flow and fluid. For some people, this results in muscle tension, stiffness, especially in the lower back and thighs, a feeling of deep soreness, similar to post-workout fatigue, night cramps, or tightness while sleeping. Researchers believe this may be due to PDE11 inhibition, a lesser-known enzyme affected by Tadalafil accumulation of fluid or electrolytes in muscle tissue, disruption of normal muscle metabolism, and oxygenation. How common is it? In clinical trials, up to 6% of users reported back or muscle pain. Symptoms usually began within 12 to 24 hours of taking the pill. Pain was most commonly reported with 5 mg and higher doses. It's not usually dangerous, but it can be annoying enough to stop treatment. Pattern break. It can mimic sciatica. Some men report sharp radiating pain in the lower back and down one leg. Naturally, they assume it's a spinal problem or pinched nerve, but when they stop the Tadalafil, the pain vanishes. It's not nerve damage. It's vascular inflammation. What you can do. Try taking Tadalafil at night so peak vasodilation happens during sleep stretch or walk after taking the pill to improve muscle oxygenation. Use magnesium or electrolyte support if cramps occur. If the pain persists, speak to a doctor about reducing the dose or switching to as-needed use. This isn't something you'll find on the medication label. There's no physical withdrawal, no chemical addiction, but for many men, daily Tadalafil can quietly become a mental and emotional crutch, altering how they see themselves, how they relate to intimacy, and how they feel in their own skin. How it starts. At first, Tadalafil brings a sense of control. You feel more confident, more ready, less anxious about performance. But over time, some users report feeling nervous or inadequate without the pill, a belief that they can't function naturally, reduced motivation to improve lifestyle habits like sleep, exercise, or nutrition. This subtle shift is called psychological dependence. Common inner thoughts users report, "What if I don't take it and I disappoint her? I'm not myself without it. I'll lose my edge if I stop. I feel more like a man when I'm on it." These beliefs, even if untrue, can shape your emotional health, your identity, and your relationships. The long-term impact. Over time, this mindset can lead to performance anxiety returning when off the drug, a sense of reliance rather than empowerment, avoiding intimacy without the safety net, feeling less confident in natural ability even if your body is functioning fine. It may even create friction in relationships, where one partner wonders, is it really him or is it the pill? Pattern break, real talk. One man, 37, started low-dose Tadalafil just to feel better. 6 months later, he said, "I don't even know if I can function without it. I haven't tried." Not because he had ED, but because his mind was conditioned to expect performance enhancement. That's the risk. What you can do, take planned breaks from the drug, e.g., 2 weeks off every few months. Work on confidence from the inside out through fitness, mindset, stress reduction. Use the medication as a tool, not as a label. Talk to a therapist or doctor if you feel emotionally hooked on the pill. Track your natural performance. You may be better than you think. Tadalafil is a powerful drug, and like any powerful tool, it can either help or harm, depending on how it's used. You've now learned about 6 side effects. Some annoying, some serious, some hidden. But here's the good news. With the right approach, most side effects can be avoided or minimized if you use the medication strategically and mindfully. Doctor-backed tips for safe use. 1. Start low. Always begin with 2.5 ml per day, not 5 ml. See how your body responds for 2 to 3 weeks before increasing. The goal is the lowest effective dose. 2. Take it at night. Most side effects, congestion, headache, muscle aches, peak within 4 to 6 hours. By taking it before sleep, you sleep through the worst and wake up with effects tapering. Hydrate. like a pro. Dehydration amplifies headaches and cramping. Aim for 2 to 3 liters of water daily, especially on workout days. 4. Watch for interactions. Never take Tadalafil with nitrates alpha blockers, excessive alcohol, certain antibiotics, or antifungals. Talk to a doctor if you're taking any heart or blood pressure meds. 5. Cycle your usage. Consider cycling off Tadalafil every few months. This gives your vascular system and psychology a reset. Use those breaks to assess, do I still need this? Has my confidence improved naturally? 6. Monitor subtle changes. Keep track of vision, hearing, sleep quality, mood, and self-talk. If you notice changes, act early. Don't wait until damage is done. 7. Combine with lifestyle, not instead of it. Tadalafil is not a replacement for exercise, weight loss, stress reduction, sleep hygiene. Think of it as a bridge, not a foundation. Final insight. Used wisely, Tadalafil can enhance quality of life. Used recklessly, it can cost more than it gives. Whether you're taking it for ED, BPH, or performance, treat it with the same respect you would any serious system-wide medication. Tadalafil might seem like a simple solution, a small pill with big promises, but after everything we've covered today, you now know the bigger picture. It can support blood flow, confidence, and performance, but it can also lead to headaches, hearing loss, vision problems, back pain, sinus issues, and even psychological dependence. Final thought. Before you make it part of your daily routine, ask yourself, am I using this to enhance my life or to avoid facing deeper health habits? Because the real power doesn't come from a pill. It comes from understanding your body, owning your choices, and making informed decisions. If this video gave you value, hit like, subscribe, and share it with someone who might be using Tadalafil without knowing the risks. Drop a comment below. Which side effects surprised you the most? And do you think it's worth the trade-off?